Aphorism 168. We shall then be able much more readily to discover among the known medicines as analog to the morbid state before us, a single dose of which, if it do not entirely destroy the disease, will advance it considerably on the way to be cured, and thus we go on. If even this medicine be not quite sufficient to effect the restoration of health, examining again and again the morbid state that still remains and selecting a homeopathic medicine as suitable as possible for it until our object, namely putting the patient in the possession of perfect health, is accomplished. In this aphorism, Dr. Heyman has given idea about what to do. By this way, we shall be able to discover similar remedy to the morbid state before us much more easily among the known medicines. If single dose of this medicine do not destroy the disease entirely, it will advance the case on the way to cure considerably. Thus, we go on further on the path of cure if even this medicine is not quite sufficient to effect the restoration of health. The investigation, the morbid state of patient again and again, still it remains. And try hard to select the most similar homeopathic medicine which is most suitable for the case as much as possible until your object is accomplished. Here, object is putting the patient in the possession of perfect health. Aphorism 169. If on the first examination of disease and the first selection of a medicine, we should find that the totality of the symptoms of the disease would not be effectually covered by the disease elements of a single medicine owing to the insufficient number of known medicines, but that two medicines contained for the preference in point of appropriateness, one of which is more homeopathically suitable for one part, the other for another part of the symptoms of the disease, it is not advisable after the employment of the more suitable of the two medicines to administer the other without fresh examination, and much less to give both together. Aphorism 272. Note: for the medicine that seemed to be the next best would not, under the change of circumstances that has in the meantime taken place, be suitable for the rest of the symptoms that then remain, in which case, consequently, a more appropriate homeopathic remedy must be selected in place of the second medicine for the set of symptoms as they appear on a new inspection. Explanation. In this aphorism, Dr. Henneman has given idea about no two remedies at a time. If on the first examination of the disease and on selection of the first medicine, we find that the totality of the symptoms of the disease would not be covered properly by the pathogenetic symptoms of a single medicine because of insufficient number of the known medicines, but in respect to appropriateness, if two medicines are for the preference, one is more suitable homeopathically for one part of the symptoms of the disease and the other for another part of the symptoms of the disease. For example, if we give one medicine out of these two which is more suitable to the case homeopathically, it is not advisable to administer a second remedy without fresh examination after employment of the one more suitable remedy. From 2. Without fresh examination, it is not advisable to give both the remedies together at a time. The medicine which seems to be the next best medicine would not be the best. Next best medicine will be the medicine which is suitable for the rest of the symptoms which remains under the change of circumstances that has been taken place in the meantime. Consequently, more appropriate homeopathic remedy should be selected in place of second medicine for the set of the symptoms as they appear on a new inspection.